Well, and that's why chronic fatigue is such a difficult disorder to pin down. And it's because the symptoms can be so varied, so different from person to person. So, the chances of two people with CFS meeting on the street and both having the same symptoms is rare. And that's why people find it difficult to identify with each other. They're trying to tease apart, well, what's CFS and what's actually the flu or the cold or brain fog because of a certain, whatever, food, or am I getting early dementia or whatever it may be. And that's why having a very good relationship with a compassionate doctor who's taking the time with you is really important. So the first thing that we have to sort of like just dispel is that there is no such thing as a standardized list of symptoms that all people with chronic fatigue syndrome have.
Hello and welcome everyone to another episode of the CFS Health Recovery Podcast. Super excited to have a special guest with us today, Dr. Olivia Lesslar. Thank you so much for coming back on to the podcast. We said we'd do a series, and so we're going to do a series. If you haven't watched the first episode with Dr. Olivia, go back and listen to it now. We talk about chronic fatigue syndrome, chronic illness. We talk really about the process of going through something like this, the suffering aspect, and what you could do to enhance your life as it is right now so you can move forwards and enjoy it more, basically. It was a really powerful conversation. In today's episode, we're going to talk about symptoms. It's a common question we get a lot on our social media channels. Toby, can you please just tell me, is this normal? Is my sore, achy legs normal? Is it normal to have swollen glands? I can't concentrate. I'm losing muscle mass. Like, what's going on? And so I'd love to kind of explore this topic with you, Dr. Olivia, because I think chronic fatigue syndrome is such a freaking puzzle. It's a maze. And, when I meet people down the street and they say, what are you doing? I say, well, we help people with chronic fatigue syndrome and other associated illnesses start living again. And they go, oh, is that just like a mental problem? Like, is that just like, yeah, all the time? Like, isn't that just depression? It's really interesting. Some people are getting more clued in now, which is really good, but I often have to explain to them, no, it's very much a neurological problem, physical problem.
Just the fact that you said that is very important, because the very fact that the medical fraternity have separated the mind and the brain is part of the problem. Separated the mind and the body, it's part of the problem.
My go-to is, no, it's very much a physical illness. It's very much neurological. And then I'll say this, tell me what you like. What's your hobbies? And they say, oh, I love bike riding. I bike ride every day. I ride 80 kilometers a day. I go, okay, cool. So I just want to ask you this. If tomorrow I took away bike riding, if tomorrow I took away the possibility that you could use your bike and you weren't able to, how would you feel mentally and emotionally about that? Oh, well, I'd feel horrible. I said, well, that's what people with chronic fatigue syndrome and chronic illnesses are going through. So, no, it's not mental, emotional. It's very much physical and neurological. And there is a mental, emotional component to it because, as you just said to me, that, if you can't do what you love to do, of course you're going to be upset about it. Of course it's going to affect you emotionally too. And so it kind of just like clicks into gear as soon as I say that. But yeah, I kind of love your thoughts on that too.
Well, and that's why chronic fatigue is such a difficult disorder to pin down. And it's because the symptoms can be so varied, so different from person to person. So, the chances of two people with CFS meeting on the street and both having the same symptoms is rare. And that's why people find it difficult to identify with each other. They're trying to tease apart, well, what's CFS and what's actually the flu or the cold or brain fog because of a certain, whatever, food, or am I getting early dementia or whatever it may be. And that's why having a very good relationship with a compassionate doctor who's taking the time with you is really important. So the first thing that we have to sort of like just dispel is that there is no such thing as a standardized list of symptoms that all people with chronic fatigue syndrome have. Partly because this isn't type 2 diabetes where there is a specific metabolic pathway, related pathways which are being affected. We know what it is, we can test for it, boom, Bob's your uncle. Chronic fatigue syndrome is literally, it's a syndrome, so it's not actually a disease, right? And these constellation of symptoms, like I said, they vary from person to person, but this destination of CFS can actually be brought up from different roads. Some people come at it post-viral, and of the post-viral family, different viruses may get you there, including now with post-COVID. Then you have some people coming to their diagnosis of chronic fatigue syndrome because of injury or accident that they never quite got better from. Surgery, sometimes that can happen. Others would be a very, very stressful life event or period of time, and they fell down after and they just couldn't get back up. I mean, there are so many ways to get to CFS, which is why it's not actually a disease, it's a syndrome.
What's the difference between a syndrome and a disease?
So a disease actually has a process that we know of, right? Like I said, with type 2 diabetes, for example, whereas a syndrome is a group of symptoms which consistently occur together, or a condition like CFS, which is characterized by a set of associated symptoms. Gotcha. So it's different. It's not actually a disease. Mm-hmm. Like IBS, irritable bowel syndrome. It's not a disease. Inflammatory bowel disease is a disease. It's not a syndrome. So the different things that people can experience, as you mentioned some of them, of course, fatigue is the main one. Yeah. But then there's also that brain stuff. So problems with memory, concentration, you have to read something over and over again, word finding difficulties. Some people, it does express as if you have a persistent viral infection, but it's not an infection, it's inflammation. Again, two separate things that you kind of need to know the difference about. Infection is where you have a pathogen, and a pathogen is like a parasite, bacterial, virus, for example, that is in the throes of essentially attacking or doing damage, and your immune system is actively fighting against that pathogen. That's an infection. Now, most infections will have inflammation. Inflammation is, like if you cut yourself, there's redness, there's swelling, there's a bit of heat, there might be a bit of itching. Inflammation is your body's first line of defense, basically, against what it believes to be a threat. So it can be pathogens, but it can also be dust mites, pollen, or even just the perception of threat by your brain can bring on inflammation. Now, I point to my arm because I was using this as an example, but you can have inflammation, nasopharynx, in your guts, wherever. And because of that inflammation that can be brought on, some CFS patients feel like they're constantly getting sick. Their immune system is shot. They're catching everything that's going around. And in our program, you and me, a lot of the time I'm trying to sort of tease it apart, whereby it may not necessarily be an infection. It may be inflammation. And inflammation will include those symptoms like sore throats and even enlarged lymph nodes, because your immune system is looking for an enemy and it's constantly like sampling the environment, taking it back to the lymph nodes to present it to other cells, immune cells, to say, have you seen this before? Because if it is a part of a virus that it's presenting, right, your immune cells will go, oh, I haven't seen that before. Let me go make some antibodies. And that's how that cycle works. And like you also said, other symptoms can be sort of that unexplained muscle or joint pain, or many people with CFS complain of unrefreshing sleep or issues with sleep.
Well, that's the myth that people don't understand. People who don't experience chronic fatigue syndrome, they just think you sleep all day and that you're kind of lazy. They're like, oh, you sleep all day. From what I've kind of watched and seen over the last decade is that there's kind of 2 to 3 stages of recovery, but they're very different. The first stage is the acute stage of suffering, where you are exhausted. The lethargy is through the roof. You are sleeping or oversleeping 16, 17 hours a day because your body's playing catch up from whatever's happened in the past, and there's almost like a restoring of credits happening. But then in stage 2, the tired and wired stage, that's where it almost goes reverse, where there's sleep irritability, broken sleep, finding it hard. There's energy in the system, but your brain doesn't know what to do with it. And so your circadian rhythm's out of whack. And so it's a real balance. But yeah, I'm so glad you mentioned that one, because I think a lot of people just seem to think that, chronic fatigue syndrome is, just sleeping all day, where for many it's not the case.
Right, exactly. And look, that's why having a practitioner that you're familiar with or who's familiar with you in your case is very important and this is a problem that happens with all patients with a chronic disease, especially patients with psychiatric issues, because everybody defines them by that. They start to define themselves by their disease. I've had patients come in to talk to me about whatever. It could be pain in the tummy, right? Oh, doc, I've got a pain in the tummy. But I also have bipolar disease. They're constantly apologizing for themselves because the world has invalidated them and their symptoms, and they start to invalidate themselves. Don't do that. You can absolutely have CFS and have IBS. You can have CFS and anxiety. You can have CFS and then have a run of allergies, but everyone starts to see themselves with this main disease picture, this main syndrome picture. I am bipolar. I have CFS. And then every other symptom that comes their way or issue that comes their way is seen through this lens. That's why it's important to have a doctor you trust.
These conversations are so funny because they just go so much deeper than the surface level. And I have to add into that because one of the things we do inside our program, we notice, especially initially, the identification of their illness and who they are. And so rather than say, hey, doc, I'm experiencing X, Y, Z, they'll say, my chronic fatigue syndrome is doing this to me. And so I pull members up, and Gemma Hanley, our resident mindset coach, will help with this too, because is it yours or is it just an experience that you're having?
You have to
Reframe. And how does it feel if you keep saying, my this, my that, it's, my depression, you're holding on to it like it's who you are. But what if you just said, right now I'm experiencing a bout of depression? How much of a difference does that feel just by saying that?
That's right. Yeah, 100%. Yeah, I totally agree. So as far as symptoms go, it's those things plus more. I mean, the whole list is there. And like you just said, you go from acute to tired and wired, and that can change with other symptomatology as well. So you can go from not having sore throats as being part of your symptom stack, and then all of a sudden you start getting sore throats. And that's why you got to check in with your doctor, because you could very well be someone who, you have CFS and, you also have an actual infection, but you need to sort that out, right? That conversation needs to happen. That check-ins need to happen.
Yeah. Let's just for the sake of people who are new to this and they're going, what's going on? I'll bring up a couple off the top of my head. Obviously, we spoke about brain fog, lethargy, concentration issues. One of the other things is dizziness. Headaches is a huge one. You've done some awesome lesson sessions inside our program on that. I know you've just done one recently. Gut issues, constipation, diarrhea, intolerance, sensitivities, anything else kind of ring to mind?
And also people have to understand that CFS, because of whatever various pathways are being activated or immune systems which is being activated, there are also associated other syndromes or other issues. So a lot of people with ME/CFS may also experience postural orthostatic tachycardia syndrome. And POTS is where you get dizziness or your heart beats really fast, for example, when you go from a lying or a sitting position to a standing position.
Yeah.
Or where your blood pools at your feet, you're not able to pump that blood away from gravity as effectively, right? So is it your CFS or is it your POTS? And this is why, like I said, the conversation with your doctor is very important. ME/CFS has also been very closely linked with EDS, Ehlers-Danlos syndrome, hypermobility syndrome. And Ehlers-Danlos in and of itself has got, I don't know where we're up to, but the last I remember was 13 different types of EDS, right? Where your collagen doesn't lay down properly, and there are knock-on effects from that, and not just being a bit bendy. And so because there are other diseases at play that may be tying in with your CFS, these diseases like to play with each other, you need to make sure that you're pinning the tail on the right donkey, I suppose. Mast cell activation syndrome is massive. Mast cell activation syndrome, POTS and EDS, they like to play together, the triad. Mm-hmm. CFS is definitely a very, very close cousin to this little group, this little gang. Mast cell activation syndrome is where you have, different definitions, but generally speaking, it's inappropriate and excessive degranulation of your mast cells in response to threats, whatever those threats are, perceived or real.
I would also add on that we haven't spoken about is the deconditioning of the body, muscle mass loss. Weight gain is also a big one, hormonal problems.
The post-exertional malaise.
Yeah, overdoing it, pushing and crashing all the time, which is why baseline is so important, which we're going to do a whole episode just on that.
Yeah.
But would you say, because, I've seen a lot of people over the past decade, like thousands of people, and lots of different diagnoses, clinical ME, CFS diagnosis, from NHS kind of thing or Stanford University. And then I've had other people who have had all these associated symptoms and suffering, yet they couldn't find a doctor to diagnose them, but their health is on the decline and it's chronic. And what I found is that the commonalities of recovery match up against...
It's the same.
It's the same. And, when people send our page a message and say, will it work for long COVID? Will it work for adrenal fatigue? Will it work for chronic fatigue? Will it work for ME, CFS, chronic fatigue syndrome? Will it work for fibromyalgia? My answer is it's not about it working for your illness. We are a health program that helps you build your health, regardless of what your diagnosis is. And so if anyone's listening, yes, it's important to identify what's going on and definitely seek medical help and find a good GP, as Dr. Olivia is saying, to exclude anything else for peace of mind. You need to know, is there anything else going on? And once the research is done and once all the testing is done, also having a proactive approach to help building your health, because as you get healthier, your symptoms start to decrease. And we just see this time and time again. And it's not necessarily about the diagnosis, it's just about the person, what they need to focus on and get help with right away, and then moving forwards with that.
This is also partly how the medical establishment have delineated and categorized certain conditions, right? So the very fact that we no longer see the person as a whole, and they are actually just made up of a sum of different organ systems, is the first problem. Whereas if you start to look at things more as not from an organ system perspective, but from a driver's perspective, for example, if you have excess inflammation in your body, you are more at risk of cardiovascular issues, skin problems, asthma, hay fever, diabetes. Inflammation it's the root for a lot of these things. Now, other factors at play, of course. Absolutely do not pin me to oversimplified things. However, if you're then able to work on your inflammation, what is it? Is it excess glycation? Is it insulin and sugar dysregulation? Because everyone thinks of insulin and sugar dysregulation as part of a diabetes picture, but that also drives cardiovascular issues too. And that's why what you were saying is, will this work for fibromyalgia? Will this work for that? That's because we're seeing things from a boxed, categorized point of view where we're not understanding that and this is our fault, this is the medical fraternity's fault, right? Where we're not seeing that commonalities, the drivers of a lot of these different things. So when we're talking about these different symptoms from different diseases, we're actually at the heart of it, we're talking about very similar pathways, very similar mechanisms. And yeah, that's why everyone's happy to say, she got stressed and then wound up with depression. She got stressed and then wound up with IBS. She got stressed and then she wound up with diarrhea. She got stressed and she wound up with eczema. So we are able to say that about stress. We know that one thing can cause all these different disease processes. And it's the exact same thing, just pull back. A healthy baseline, a healthy diet, healthy behaviorisms, healthy mindset, that will take you far in whatever disease process you are dealing with.
Well said. Well, amen. The two things that we didn't talk about, we did at the start, but the two other, symptoms of suffering is secondary depression and secondary anxiety. And what that basically means is you don't just have depression for the sake of having depression. You're depressed because of a secondary problem or a first-hand problem, which is chronic fatigue syndrome, for instance, and you can't go and do the things you want to do, and therefore you're depressed about that. And so it's a really common thing that we see with people is their mindset and emotional well-being is so affected from their physical limits and struggle and suffering. And so I just wanted to mention that just for peace of mind out if you guys are out there right now and you're really dealing with that, like just give yourself a little bit of grace and just understand that I think anyone would feel that way. You know, it's a totally appropriate response to feel when you're in the suffering. And as an option, there are ways that you can get back into the now and focus now and for the future versus missing and loathing the past, you know, and grieving in that. And, you know, Dr. Olivia said in the first episode with her about having that agency, going from victim to victor, having that sense of agency within yourself and knowing, well, what can I do to change this? You know, what can I do that's in my control that can help me right now? Because one thing is I can have a pity party and I can throw that every day if I wanted to, but over time, not many people want to attend that party anymore. And it's a pretty lonely one. And that's a big shout out to Craig Harper, one of my first ever mentors. He used to talk about that a lot. How's your pity party going? Because usually there's only one person at the party and it's just you, and it's really not much of a fun party. And I love that. And it's so true, whether it's chronic illness or just life, you know, life, relationships, business, whatever it is, we can easily get into that mindset, or we can go the other route and go, well, what does being a victor today look like for me? You know, it doesn't have to be this strong, hard, harsh approach. It can be, well, being a victor today looks like giving myself some permission to just be. Not trying so hard, not overcompensating, and just allowing is what a victor could look like today. You know, it really is dependent on you and your situation. So, yeah, any last words you want to talk to on this? I feel like we kind of went pretty deep.
Look, you know, you wanted to talk about symptoms, and I think that people, if they're asking random strangers on the internet what symptoms of CFS look like, it means that they don't have a good relationship with their doctor. So that's something that needs to be rectified. And okay, fine, you may not have someone near you, but there's always Zoom that you can do. Or it doesn't have to be a doctor, right? It could be a health professional who understands CFS. Because once you've gone through the medical ringer and you've got your diagnosis, then you just need some help and support with regards to your diagnosis. And, you know, programs like CFS Health are very helpful because there are lots of people in the program who are going through something similar. There's obviously the coaches. I think, three of you came out the other side of CFS. Is that right? You, Jem, and Erin?
So we've got 4 specialist coaches right now, Erin Enright, Ahil Gannison, Gemma Hanley, and Steph Ryan, who've come out the other end of their recovery. And yeah, they did the actual program, and then, you know, they went on to do their own studies in their own fields. So obviously we have a specialist in movement, specialist in mindset, specialist in general health and well-being. So it's pretty cool.
So including you, that's 5. And I think with the patients, it would be sometimes when a new symptom pops up, of course, you got to make sure that it's not a separate disease process, right? But it's important for patients as well, that because I see this all the time in clinic for all chronic diseases, not just CFS, but they're constantly chasing as opposed to settling in and just doing the work, because the work is going to see you through whatever is happening, right? And yeah, I think there's something about the chasing which I see.
100%. And I'm so glad you mentioned that, because I think it's a perfect way to finish is like, we don't have a symptom approach at CFS Health. We have a health approach. We're not even an illness program. We're a health and life program. And you know that. You've seen the content and how deep it goes into not just getting healthy, but just like, what do you value? And like, what are your values now? And are you aligning to it? What are your goals for the future? You know, getting really in touch with yourself and having that future focus is just so important. So, you know, I think it's just spot on as like, yeah, once you've got your diagnosis, or even if you don't, I was lucky after 2 years that I did get a diagnosis from a specialist. But in saying that, I'm the type of person that almost don't care. Just tell me what to do. Like, what can I do to help myself, you know? And there are those people who need that confirmation first, which is so understandable. And then there's other people who's like, I had a client once in England who said, I'm on a 12-month waiting list for the NHS. I want to do your program right now because I don't want to wait and do nothing for the next 12 months. And it was awesome because she went from like struggling and no idea of what a baseline meant to then literally, you know, rebuilding and regaining her life back again and no longer needing that appointment in the first place. So, you know, you don't have to wait for things. You can start now by taking that control back in yourself and focusing.
That's the problem with these conversations with you. We can go on and on and on. I know you want to wrap this up, but I was just going to say about, I do less and less testing with patients now because a lot of these tests are expensive. Right? There's the standard tests, which for many countries, luckily, it's covered by Medicare or NHS or whatever it may be, or insurance. And then once those ones are normal, which inevitably they are, you're someone with CFS, then you start doing some specialized testing, right? And it starts to get into the hundreds, if not thousands of dollars. And I always say to patients, how does this test change management? That's why I rarely do. I mean, don't get me wrong, I of course still do, but I rarely do microbiome testing as a first off because they're very expensive. You get this massive list of all these gut bacteria that's in there. And then it's, well, what do I do? Because at the end of the day, the answer, generally speaking, is very similar to what you would have done if you didn't get that microbiome test. That is, cut out the shit, add in the good, healthy fats, eating regularly.
Long-term approach, yeah.
Right, exactly. So because, look, I'm a terrain doctor. That's why I don't deal too much with probiotics. Prebiotics, yes, but I don't do too much with probiotics anymore. Little bits and pieces here and there, like those with very, very good evidence for sure. But I'm a terrain doctor, so I work more on what is the gut looking like? What's the food you're putting in there? What's the pH doing? How often are you having a poo? That kind of stuff, because when the terrain is right, the right bugs will grow. Simple as that. So how does testing change management? Because I've seen patients chase these tests and trying to chase a diagnosis and and there's definitely relief when they get their diagnosis, but they realize it didn't change.
But then what? Exactly. And also there's a really dark rabbit hole that what you focus on expands, and so you'll just keep expanding and focusing on all the shit and how bad it is when you have only a precious amount of energy that you've got right now that you can utilize for healing, and moving you forwards too. So thank you so much for this conversation. I'm sure it's been really, really eye-opening and helpful for these guys. So thanks again, Liv.
No worries.